Hi, I'm Ting-Chun from National Taiwan University Hospital, Taipei, Taiwan. Today I want to talk about this article published on JACS, Transcutaneous Laryngeal Ultrasonography for assessing vocal cord twitch response in several operations during pre-dissection vagus nerve stimulation. Intraoperative neuromonitoring of the recurrent laryngeal nerve has gained acceptance among surgeons to predict and document nerve function, and it could provide real-time information that could help guide the surgical procedure. But some difficult consequences will encounter where the normal nerve function is evidenced by the presence of a laryngeal twitch, but there's no EMG signal is present. It called a false, no element signals. But what we can do next? Assessing of the laryngeal twitch response by the surgeon's palpation is recommended as one of the first steps of IOM. However, interpretation varies among surgeons, and the small incisions might limit the possibility of the palpations. Transcutaneous laryngeal ultrasonography that specially assesses the neck structure and has a high applicability. It could become a real asset and a non-invasive tool for assessing the laryngeal twitch response during nerve stimulation intraoperatively, as shown from this illustration. We are wondering, is this technique better than palpation? So we conduct this study, and it's the first to report our experience of intraoperative use and to examine the reliability in comparison with palpation. Ultrasonography performed by our surgeon to evaluate if there was an ipsilateral vocal cord twitch response while undergoing pre-dissection vagus nerve stimulation. A total of 110 patients was enrolled in this study. As a result, TLUSG is better than LTP in accessible rate, sensitivity, and accuracy. From our result, we propose an algorithm for patients when encountered with no element signal during pre-dissection V1. If the TLG was negative, we will wait until muscle relaxation wear off. We will use a proper dose of antagonist, and if the TLG was positive, we will recheck with a laryngoscope and adjust LM sensor location if necessary. In conclusion, TLG is better for evaluating the laryngeal twitch response than palpation, and it provides practical troubleshooting guidance for patients with no arm signals during pre-dissection vagus nerve stimulation. And thank you for your listening.